Okay, today we're going to talk about diseases and conditions of the musculoskeletal system. They have major categories. We're looking at diseases of the bones, joints, ligaments, connective tissues, and muscles. So there are 206 bones in the skeletal system. It provides physical support and protection for the organs of the body. The actions of muscles and bones allows, excuse me, physical movement, and marrow within the bones produces blood cells. Any pathology of this system greatly affects activities of daily living. Fibromyalgia is a rheumatic condition. There's a widespread muscle and joint pain with fatigue and appears to be linked to changes in the way the brain processes pain signals. The ACR stands for the American College of Rheumatology. They're guidelines for diagnosing fibromyalgia. It has to be widespread pain throughout the body for at least 3 months and have 11 of the 18 tenderness points. So we're looking at the neck and shoulders, okay, the elbows, the hips, and the knees. Pain on both sides of the body as well as above and below the waist. Now, we are born with a kyphotic spine, with a primary curve in the upper spine. As we grow, we develop secondary curves. As infants, we develop a lordotic curve in the cervical spine to hold our heads up, and as toddlers, we develop a lordotic curve in the lumbar spine to walk. So we have 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 fused sacral vertebrae, and the coccyx, which is 4 to 5 fused. Okay, and that the coccyx is the same thing as the tailbone. Okay, the thoracolumbar region is where the thoracic and lumbar regions come together. Okay, so that would be like right in here. Now, let's talk about lordosis. There's an excessive inward curvature of the spine. It's also called swayback. Lordosis differs from the spine's normal curves at the cervical, thoracic, and lumbar regions. The spine's natural curves position the head over the pelvis and work as shock absorbers to distribute mechanical stress during movement. Ketosis. This is an excessive outward curvature to the upper spine. It's also called a dowager's hump or a humpback, and it's usually in the thoracic region. Scoliosis, it's a lateral curvature, and it can go to the left or the right. Okay. Osteoarthritis. This is a type of arthritis that results from the breakdown and eventual loss of the cartilage of one or more joints. Often involves weight-bearing joints such as the knee and hip, and joints in the fingers, the interphalangeal joints. And the phalanges are the fingers, so it's between the finger bones. It's a chronic inflammatory process of joints and bones that results in degeneration of joint cartilage and formation of new bone. Lyme disease is caused by a spirochete bacteria, Borrelia burgdorferi. 50% have a bullseye rash. It's transmitted to humans by the deer tick Ixodes species, Ixodes. Bursitis. This is inflammation of a bursa, and a bursa is a tiny fluid-filled sac that covers bony prominences. It's found between the muscles and the tendons, and they're used to reduce friction. See like the little bursa right here? Okay, and then there's the olecranon bursa, where they get inflamed. Osteomyelitis is an inflammation of the bone. Usually affects the long bones in children and the vertebrae and pelvis in adults. Often caused by infection. 90% is from Staphylococcus aureus. As the infection progresses, pus may form and sustained inflammatory pressure may cause fracturing of small pieces of the bone. Gout. 95% are male, caused by metabolic error in production or excretion of urea from protein metabolism. Uric acid crystals accumulate in the joints, and this can be caused by hyperuricemia, renal dysfunction, or kidney stones. And then you have what they call tophi. These are deposits of urate compounds in and around the joints of the extremities. These frequently lead to joint deformity and disability, and they may deposit under the skin, on or near the joints. Very painful attacks that last anywhere from 1 to 8 days. Okay, and there's all right. Now the treatment for gout, you want to modify your diet, so you want to avoid alcohol, limit your protein intake, and increase your water intake. And that clears the uric acid by the kidneys. Okay, medications are allopurinol and probenecid, and you want to monitor for kidney stones. So proteins are the reason why you want to limit your protein intake is because proteins are broken down to purines, which are broken down into uric acid. Paget's disease, and this another name for that is osteitis deformans. This is a chronic metabolic skeletal disease. Initially, it is marked by a high rate of bone turnover. Bone is rapidly reabsorbed and replaced with bone of a coarse, irregular consistency. Consequently, the affected bone becomes thicker but softer. A later phase of the disease is characterized by the replacement of normal bone marrow with high vascular fibrous tissue. Early in the course of the disease, old bone starts breaking down faster than new bone can be built. Over time, the body responds by generating new bone at a faster than normal rate. This rapid remodeling produces bone that is softer and weaker than normal bone, which can lead to bone pain, deformities, and fracture. Okay, and you can see that this is a normal bone on this side, and this is the osteitis deformans. Okay. Marfan syndrome. This is an inherited disorder. It affects the connective tissue. As a result, it can affect many different body systems, including the heart and blood vessels, eyes, and the skeleton. Characteristics: they are tall and thin, with disproportionately long arms, legs, fingers, and toes, heart murmurs, extreme nearsightedness, and the damage can be from mild to life-threatening. And some people who are believed to have more fans, Abe Lincoln and Michael Phelps. And I don't know if you remember him, but he, in the summer of '08 in Beijing, China, he was had Olympic gold medals for swimming. Osteoporosis, or porous bone. It's characterized by a low bone mass and deterioration of bone tissue. Okay. Vitamin D is especially important to bone health and dietary calcium utilization. So the body needs vitamin D to absorb calcium. With a vitamin D deficiency, the body can't make enough of the hormone calcitriol, which is the active form of vitamin D. Calcium in the bone is in the form of calcium phosphate. Another name for that is hydroxyapatite. It forms the crystal matrix for bones and teeth. Lack of estrogen in postmenopausal women prevents absorption and utilization of calcium. It enhances the ability of the osteoclast to absorb bone. Since the osteoblasts, the ones that produce the bone, are not encouraged to lay down more bone, the osteoclasts win and more bone is lost than produced. Rickets and osteomalacia. It's rickets in children and osteomalacia in adults. It's two forms of a metabolic bone disease resulting from vitamin B deficiency. Both cause softening and weakening of bones because of a defective or inadequate bone mineralization. Vitamin D regulates calcium absorption in the body. It also controls levels of calcium and phosphate in the bone. Vitamin D is absorbed in intestines from food. Vitamin D is also produced by skin during sun exposure to UVB rays and sunlight. Okay, so malacia is softening. Hallux valgus. It's also known as a bunion. It's a localized area of enlargement of the inner portion of the MTP joint at the base of the big toe, and that's the metatarsophalangeal joint. So this is a metatarsal, and these guys right here are the toes, and these are the phalanges. So the metatarsophalangeal joint. Okay? Now, hallux rigidus is a stiff big toe. It's rigid. Degeneration of cartilage of the first MTP joint. Okay, here we go. A hammertoe. This is the toe bends upward. Toes bend upward like a claw. Abnormal flexion of the proximal interphalangeal joint. Okay, right in here. You see how this joint, it kind of goes up? That's the proximal interphalangeal joint right there. Okay, so we have, we're going to talk about the different types of fractures. And then they have this, so this is normal bone. A transverse is when the break is straight across. Oblique, it's angled, see like that. A spiral, so the break twists around the bone. Okay. My dad got one of these when he was playing softball, and he planted his foot and turned his body, and it just broke it. It was a spiral fracture. Comminuted means it's shattered. Segmental, as you can see, there's segments. Avulsed, when you have a bone fragment and it's torn away. Okay. Impacted, right here, the fractured ends of the bone are driven into each other. A torus and a green stick. The bone is partially bent and split. Okay. Okay, so I'm going to just go on and we're going to talk about it. I'm going to show you pictures and I'll tell you what they are. Okay. This is a non-displaced fracture. This is the bone ends remain in alignment. Okay. Now, in a displaced fracture, now this particular one is of the tibia, the bone ends are out of alignment. Okay. The open tibia fracture, this is a complete fracture which penetrates the skin. So you can see how that bone is coming out. Okay, there's the green stick right there. The green stick fracture is fracture on one side of the bone, the other side is bent. And let's go to the next group. The compression fracture is when the bone is mashed down. Okay, so you would like fall down onto your tailbone and it would just mash the spine. Okay. The next one is a comminuted fracture, and then this is when the bone is splintered or crushed, often with fragments embedded in the surrounding tissue. Okay. An impacted fracture. One bone end is forced over the interior end of another. So that's normal, and then you see how it's one's over the other. The spiral fracture, the break twist around the bone. A Colles fracture, okay, this is a fracture of the distal head of the radius. And this happens, a Colles fracture, think about if you're going to fall and you put your hand out and you fall on it, basically falling on your wrist, and it'll just crack it. Okay. A Potts fracture right here is a fracture of the lower part of the fibula. Okay. A Le Fort fracture. This is a bilateral horizontal fracture of the maxilla. Okay, so right across here. Okay, so we are going to end this right here.